Hi, my name is Matt Clarkson. I'm a lecturer in medical physics and I'm part of the Welcome EPSRC Centre for Interventional and Surgical Sciences. So my job here as an engineer is to build systems to help surgeons do surgery. The clinical background to this project is that liver cancer is a major global health concern. And for the patient, we want to be able to do this minimally invasively. That means keyhole surgery. However, there are some real technical challenges. Now, on this project, myself and the wider team at UCL have already built a system that we've taken to the Royal Free and we've demonstrated with, and used with surgeons. Essentially, when a surgeon decides that surgery is too risky to be done via keyhole, they use open surgery. So we need a system that reduces risk. And we do this by taking the CT scan and overlaying it on top of the video. This gives the surgeon the perception of 3D. As he looks at the video, he can see inside the liver vessels, tumours and the anatomy in order to guide him through the surgery. So the real benefit is that we've taken this to the surgery already. We're working with surgeons and getting real feedback. However, the key technical challenges remain in computer vision and we believe that many of these can be solved through the newer paradigms such as deep learning. So I'd like to just hand over to my colleague Dan Stoyanov, who will give a bit more technical detail on those aspects.
I'm Dan Stoyanov. I am a professor in computer science at UCL and I'm also a member of the Wellcome Trust EPSRC Centre for Interventional and Surgical Sciences and very closely involved with UCL Robotics and also the Center for Medical Image Computing. So this project is really, really exciting because it allows us to work in computer vision for surgery. And computer vision has really been revolutionized over the last few years through the emergence of deep learning techniques and very powerful computing. And this means that we're able to use modern algorithms in a much more powerful way than we were previously able to in surgery. So we want to model very complicated things like the deformation of the liver, the type of shape that a liver can have, the reflectance properties of the liver, and the type of augmentations that a surgeon might perform to a liver during surgery. These are things that are very difficult to model directly. So when we've worked on vision in this space in the past, we've tried to use forward modeling in order to model how we can reconstruct the shape of the environment, how the instruments move, the type of procedures that or sub-procedural tasks that the surgeon is performing. And now we're looking at more data-driven approaches in order to allow us to infer what some of these models may be. So it's a really exciting time to be at UCL to do this work. We've got a very strong collaboration with the clinical team that performs the surgery, and the computer science department is one of the leading departments in the UK, in Europe, and actually worldwide in the computational techniques that we're going to be using in this space. So we're very much looking forward to working on this project with you.